Assalomu alaykum. Men Komilova Nigora, Ildar qizi. 1991-yil 5-oktyabrda Farg'ona viloyatida tug'ilganman. 3 yildan beri autoimmuniy kasalligi bilan og'rib kelib, autoimmuniy kasallik buyragimga ta'sir qilib, yanvar oyida buyragimning ish faoliyatini to'xtatdi. 8 oydan beri dializga qatnab, dializ olib yurardim.
Actually, the dialysis was not done in a proper manner in Uzbekistan. So young patients, they are very unstable on dialysis. Because of that, the dialysis becomes challenging. The heart function also gets worsened on dialysis if they are on dialysis for long time.
Shu kasalligim kuchayayotgan sababli xo'jayinim Hindistonga olib borib operatsiya qilishni tavsiya qildilar.
Once we evaluated her, we found she was in fluid overload, liver was also enlarged, ascites was there, the EF was 10-12%.
Doktor Rana bilan ko'rishdik. Ular bizga operatsiya qilishni tavsiya qildilar.
But it was very critical. She was not stable at all. So we did initially some dialysis, improved her general condition. We could just get the cardiac function up to around 14-15% EF. She was little safe, that ascites was reduced, the swelling in the lungs, there was fluid overload condition was better controlled. In that circumstance, we took up the challenge and did this kidney transplant.
Hozirgi kunda yuragim ish faoliyati esa 30% ga ko'tarildi. Bunda menga yordam bergan xo'jayinimga
Xudoga shukr, qizim ham yaxshi, o'zim ham yaxshi. Xudoga shukr. Rahmat doktorlarga, hammalarga.